All right, so what we have here is we have the pelvis. The pelvis. It's three bones. It's three bones. We have the ilium, which is this large bone right here. We have the ischium, and we have the pubic bone. So the pubic bone, ischium, and this big old wing guy right here. This is the ilium. They all come together here in this hip joint. It's called the acetabulum. The acetabulum itself. So when you orient yourself, you actually have to look at it. And the first thing I would do is the acetabulum always has to point laterally. So it's got to point outwards. And the pubic bone here needs to be in the front. So this is the way this one's oriented. So you're looking in the front. So that means this is the left. This is the left hip. Looking at the structures of the hip itself. So this is the ilium. This top here, this is the iliac crest. The iliac crest. Okay. This is the anterior portion. This is the posterior portion. So that means we have an anterior superior iliac spine. We have the anterior inferior iliac spine. So anterior superior, anterior inferior, iliac crest. So if we look at the back of our pelvis here, we have posterior superior, posterior inferior iliac spines. So posterior superior iliac spine, posterior inferior iliac spine. Here, there's a little groove. This is called the sciatic notch. This is where a sciatic nerve comes out. Okay, so ilium, all the structure of that. Now we have the ischium. The ischium. Okay, this is this bone right here. This is the ischium. This hole right here, this is called the obturator foramen. Obturator foramen. So we have an ischial spine right here. So the ischial spine faces medially on the inside. And then we have the ischial tuberosity. See this little groovy thing right here? This groovy thing. This is your butt bone. This is what you should sit on. Most of you sit like this. You should actually sit like this, not like this. This is the correct way. And then we have here, this is the pubic bone, right here. This is the pubic bone. So if you look at it face on, pubic bone, pubic bone. So here, where the two pubic bones come together, this is the pubic symphysis. The pubic symphysis. Okay. The next bone we have is this guy right here. This is the femur. This is the femur. It's a very long bone, so we're going to look at it in two spots. So again, when we look at the femur, look at the head of the femur. They should always point medially. And if you look at the end of the femur, okay, these two condyles, they should always face posteriorly. So this guy here, this is our right femur. This is the right femur. So on the list, this center part of the bone, this is the diaphysis of the bone. It's the shaft of the bone. But I'm not going to ask you that, so don't sweat it. So the femur here, we got this guy, we got this ball part. This is the head. This is the head of the femur itself. This here, this is the neck of the femur. And then we have two projections here. We have a greater trochanter. That's this guy right here. So we look at it at all angles. This is the greater trochanter. And then we look on the medial side here. This is the lesser trochanter. Then we go spin the bone around. So we're looking at the distal end. This right here, this is the patellar surface. It's patellar surface. Okay. Then we have the medial and lateral condyles. This is where the tibia sits. Medial and lateral condyles. Okay. And then we have the medial and lateral epicondyles. And then here, this groove, where my finger is in, this is the intertrochanteric fossa. So that is the femur. Next, we have the tibia. This is the tibia itself. So again, we have to arrange ourselves in how it's right or left. So the easiest way for me to do this is you look at this guy here. This guy. Okay. This is called the medial malleolus. So it's got to face medially. Okay. And then you have this little bump here. This is called the tibial tuberosity. It's got to be anterior. So you have this anterior, and you have this facing medial. Okay. So this makes this the right tibia itself. So let's look at the tibia. So you can see here we have this flat portion of the tibia up here. This is the tibial plateau. Okay. Now since this is medial, this groove is the medial articular surface. That makes this the lateral articular surface. So this is the medial condyle. This is the lateral condyle. And again here, this is the tibial tuberosity. So you look at it from this direction here. Tibial tuberosity. Okay. And again, down here, this is the medial malleolus. This is what's called the quote-unquote ankle bone. This is the ankle bone. So if you break your medial ankle, this is what you're actually breaking here. The next bone we have the fibula. Fibula. Okay. The only thing you need to know about the fibula is I'm not going to make you do left or right, because what the hell are you looking at? I mean, this is like, it's the fibula. That's all you need to know. But you look at this weird guy right here. This is the lateral malleolus. This is the lateral ankle. So when you sprain your ankle, usually you roll your foot outwards. This is actually what you split, which is you actually injure this area right here. So it's this little wimpy long bone. I mean, that's the fibula. So this is the lateral medialis. And then finally, we have the foot. Okay, so this is our foot right here. So again, let's orient it correctly. So the calcaneus, this is the calcaneus. Okay, the big guy, this is your heel bone. Okay, it has to face downwards because this is how you stand. And then here, this is the great toe. Okay, this is toe 1. This has to face medially. So again, which foot is this? This is the right foot. This is the right foot. So these guys are tarsal bones. These guys are tarsal bones here. That makes these our metatarsals. Okay, and then we have our phalanges. So we have first, second, third, fourth, and fifth. Okay, so first metatarsal, second, third, fourth, and fifth metatarsal. Then we have our phalanges, and they follow the same rules as the fingers. So we got proximal and distal, phalanges, proximal, distal. Then we got proximal, intermediate, distal, proximal, intermediate, distal, proximal, intermediate, distal, proximal, intermediate, distal. That's how that works. Calcaneus here, talus here. Calcaneus, talus. This huge, calcaneus, talus. Those are the only two bones you have to know the names of: calcaneus and the talus. So those are the bones of the lower limb.